Okay, today I'm gonna demonstrate catheter care, emptying a urinary drainage bag. For this one, you might have to zoom in to see what I'm doing because it's a little bit hard probably for you to see from far away. As with everything, you're going to explain what you're gonna do to the patient, perform hand hygiene, and close our curtain for privacy. So, Miss Sue, hi, good morning. Let's pretend she's covered. I am gonna clean your catheter and empty your catheter as well. I'm gonna go grab my supplies, wash my hands. Let me close your curtain for privacy. I'll be right back. Here's your call if you need anything. I'm gonna close my curtain. I'll go wash my hands. I'm gonna grab my supplies. Again, I'll be right back for water because we're going to wash the catheter, so you will need water. So for this one, don't forget you need chucks because you're going to protect the linen from getting dirty. You're gonna need one washcloth for soap, one washcloth for water. I just brought an extra one, but you have a towel that you're gonna put in between the patient's legs to protect the catheter. You need some gloves. I'm gonna go grab some water. For this one, you don't have to check temperature because you're not going to touch the patient with the water, so cold water is fine. And soap, don't forget. So I'm gonna go grab some water and some soap. And you are going to, so it's a one skill. So it's really 3 in 1 because one is catheter care, and then it connects to drainage of the urinary bag, and then it connects to hand washing. Make sure you do all 3. You can clarify to your RN tester if that's exactly what she wants, or if she wants to do 3 different ones, or your skill that says catheter care, empty drainage bag. All right, I'm gonna put my gloves on because I'm getting ready to clean the catheter. Cleaning the catheter is very important because we don't want to have extra bacteria entering the urethra and causing a urinary infection. Make sure you have your hamper ready because you're going to be disposing of the dirty washcloths. Bring your bed to a comfortable position. I always tell my patients kind of what I'm going to do so they're aware. You should not be uncomfortable, Miss Sue. All right. I am only going to expose the area of the catheter. Let me know if you get cold. I have my towel ready to go. I'm gonna lift your gown now, Miss Sue. All right, very careful that you don't pull this catheter. Very carefully, you are going to position it here in the middle of her legs without pulling the catheter. Then you're gonna proceed by checking, make sure that the catheter is not kinked and that is flowing urine fine. All right. In the past, I show you to do catheter care like this, remember? I actually mash them together. So no need to clean the labia for this particular skill. We're only cleaning the catheter, emptying the urinary bag and washing our hands. So no cleaning of the labia for this skill. We'll do perineal care of the female later, and I believe she does not have a catheter for that skill. So I'll show it to you next. All right. So now that I have my clean water, I have my 2 washcloths that I'm actually gonna put in there. I grab one, I rig it. I am gonna need my corners, so make sure that it's nice and folded. And I'm gonna do 1, 2. Most likely you only need 2 to 3, but we'll do all 4 just in case. My soap is there. That's my clean water. All right, very important. You're going to hold the catheter at the opening of the urethra. All right, that's the pee hole. Because when you pull on the catheter, you don't want that to move at all because you can cause some discomfort and damage to the urethra. All right, so with one corner with soap that is nice and clean, you're gonna start about an inch or so from the patient's urethra, and you're gonna go down 1. Don't let go of that catheter. 2, and I'm using a clean corner every time. 3, and 1 more. 4. Very good. I'm gonna let go carefully. Put that in the dirty hamper. I'm going to rinse it now. Same procedure. I'm gonna hold my catheter and we go 1, 2, 3, and 4. Very good. I'm going to place that on the dirty hamper. And then again, I'm gonna hold these and then I'm just gonna pat dry my catheter. All done. Very carefully. I'm going to hold it and remove the towel. You put her catheter back and you cover her. Then you're gonna proceed to empty your urinary bag. For this one, I'm gonna move my table away from me. I'm gonna replace her top covers. All right, I'm gonna cover you up. I need to put her bed down because I'm gonna leave her to go grab my graduate, a cover for the floor, and the alcohol swab, okay? So then you're gonna lower her bed. So patient doesn't fall. I'll be right back. I'm gonna go grab my graduate. Actually, I have a graduate right here. So I have my graduate that I am gonna use, and I'm gonna grab a paper towel, an alcohol swab to empty my urinary bag. Your RN observer should tell you when to stop draining. So you're gonna put your barrier on the floor. You're gonna put your graduate. I don't know if you can see me, so maybe let me bring the phone closer so you can see it. Okay. Remember, I like to open my alcohol swab so I'm not trying to handle things with one hand. Here's your urinary bag. This one has the spout right here, and this one lifts up. There's some that are pinch, so depending on the catheter that you have will be different, okay? So I like to raise the head of the bed. You can drain it like this if you want as well, it's no problem. Just have to be able to maneuver with one hand, okay? So I'll show it to you with one hand. Actually, let me raise the bed. That's probably what you're gonna end up doing anyway. So let's raise the bed a little bit. I'm gonna raise your bed, Miss Sue, just so I can drain your urinary bag much better. A little bit more, just a little bit more. That's perfect. I'm gonna put this underneath. So now I'm ready. Make sure that this spout does not touch the side of the graduate, otherwise you have failed the skill. All right, I like to pinch it as I'm opening the little clamp. I'm gonna let go let's suppose that my RN tester said, okay, enough. So I'm gonna close it. In reality, you empty the whole thing. She might want you to empty the whole thing, he or she. Here is where I am going to, and you can shake it very carefully that you don't spill. I'm going to clean the spout, put it back, grab your stuff, lower your patient's bed because you're about to go and empty it. Don't leave your patient with the bed high. Okay, I'm gonna bring you with me here with the phone. Sorry guys, it's me recording these by myself. So let me just bring these up a little bit so you can see me. Okay. So I have my dirty stuff from the floor. I place my graduate on a flat surface so I can measure my urine. This urine is measuring right now 200. I'm waiting for the urine to settle because it's moving. So it's 200. So I'm gonna go ahead and empty it into my toilet. Let's leave this open. I grab some water. You can't see it, but, or maybe you can, I don't know. You grab water, you rinse it. Very good. It's a toilet, so you flush the toilet. You grab a paper towel. You clean the inside. I'm gonna remove my gloves. I'm gonna grab a clean paper towel. I'm actually gonna grab 2 clean paper towels. One to bring these over. And one, depends when you go to do your test where the supplies are. So grab that. Perfect. Putting that there. Grab my water, my stuff. Bring this over. We're gonna empty your water. Give it a nice rinse. Very good. And now the third part of the skill is hand washing. And if you remember, I'll demonstrate it, but if you remember, it's 20 seconds, okay? All right. Okay, my hands are dirty. I'm gonna open my water faucet. I'm gonna wet my hands. Get some soap, and I'm gonna start. So I'm gonna do my palms. I'm counting my 20. I'm gonna lather every part of it. In between my fingers. My nail beds. My nails by doing these. One more little thing. All right. Try not to touch, or better said, do not touch the sink at all. I'm not gonna close it with my clean hands. I am going to grab my paper towel. If you need to, you can grab 2, it's no problem. I'm gonna throw this one in the trash. And I'm gonna grab a brand new one to close my faucet. I do not use it to dry my hands anymore. You're just gonna close the faucet and throw this away. And you're done with your skill. If you want to go back to your patient, and you can say the same thing that you always do, is here is your call light. If you need anything, Miss Sue, let me bring your bedside table. Here is your water. Let me know if you need anything. And that's the end of your skill.